Hello everyone, welcome to our short video session. Today we'll be discussing briefly about the role of MRI in breast cancer. So this is an exam oriented 2 minutes video on role of MRI in carcinoma breast. Let me tell you, MRI in breast cancer is not a routine examination. We should not do MRI for all patients. Now what are the indications? I remember them as APIS, APIS. What is that? This is for diagnostic purpose. A stands for axillary nodal metastasis with unknown primary. Okay, so you have an axillary metastatic node without any known primary. So there comes the role of MRI both breast. Then P for Paget's disease, because we know most of the patients of Paget's disease are either harboring DCIS or an invasive carcinoma inside the nipple. I stands for patients with implants. Okay, S stands for screening. Screening of whom? Screening of patients with young individuals with high risk features like BRCA positive. Okay, so these are the indications, diagnostic indications of MRI. Now what are the indications when once you diagnose a patient with breast cancer? Here comes the role of MRI in patients where you suspect there is high chance of misdiagnosis in mammography or ultrasound. That means patients with denser breast. Okay, patients with denser breast, young individuals. There MRI helps you to diagnose any multiple lesions or multicentric lesions in ipsilateral breast or any surprise in the opposite breast. Okay, so especially where you get patients with denser breast, there you suspect either a multifocal lesion or any lesion in the opposite breast, you do an MRI. Okay, not only that, response assessment, especially patients where you have planned for NACT and followed by BCS. In these patients, response assessment and your assessment of the tumor shrinkage is very important. There comes the role of MRI. Now having said that, it must be remembered that MRI has got high false positive rate. False positive means it will pick up any smaller lesions as a malignant lesion. Okay, so any lesion you pick up in MRI, you need to do an biopsy from that new lesion to prove that it is malignant or not. You cannot just do a mastectomy on the basis of a finding that MRI is showing 2-3 more lesions. You need to biopsy them. So at times it becomes difficult to biopsy them if they are not visible in ultrasound or a mammo, because the availability of MRI guided biopsy is very low. Okay, now having said that, you need to remember this APIS as well as to detect multicentricity as well as to detect opposite breast lesions for high risk individuals, that means patients with denser breast, and where you are planning for neoadjuvant chemotherapy followed by BCS. These are the indications of MRI breast. Thank you very much.